Hello, I'm Dr. Rhonda Johnson. It's Monday, May 19th, 2025, and I'm doing a COVID refresher. Right now, LP 8.1 is the dominant variant in the United States, responsible for 70% of COVID cases in the United States. Now, according to the CDC, 2 states have rising number of COVID cases, Hawaii and Nevada. But what matters most, no matter the variant, is understanding how COVID spreads and how we can protect ourselves. So just recently, a group of people in a community setting that I know tested positive for a COVID in a short period of time, nearly about 24 people. Thankfully, most had mild illness, but it's a powerful reminder that COVID-19 is still circulating and it can spread quickly in indoor spaces. So here's what you need to know. COVID spreads through airborne particles, not just droplets. So when an infected person breathes, talks, sneezes, coughs, or even sings, they release particles into the air that can travel beyond 6 feet and linger for hours, even after that person leaves the room. Now, these particles move with the air, and they move throughout an entire indoor space, especially one with poor ventilation. So you walk in, you breathe these particles, and you get infected. Now, you can become contagious as early as the day that you are exposed. That's because viral shedding can start before symptoms appear. And this overlap between the incubation period and the infectious period is what makes COVID so tricky to contain. Now, most people will develop symptoms within 3 to 7 days, but it can take anywhere from 1 to 14 days. Now, what are those symptoms? Common symptoms include fever, chills, headaches, muscle aches, loss of taste or smell, nausea or vomiting, especially in children, sore throat or tickling in your throat, cough, and shortness of breath. Now, on average, people remain contagious for about 8 days after testing positive, but more severe cases may take longer. Now, you're generally considered contagious until your rapid test is negative. Now, some online sources say that morning is the best time to take a rapid COVID test because that's when viral levels tend to be highest, which can lead to more accurate results. Now, remember, if you test positive, the best path to recovery includes rest, plenty of fluids, over-the-counter medications for fever and body aches, wearing a mask at home if you're around others, and avoiding strenuous activity while your body heals. Now, talk to your doctor always about your symptoms and your scenario and find out whether you're eligible for Paxlovid or other COVID-19 antiviral treatments. These medications can reduce the risk of severe illness, and that's especially important for people with underlying conditions or for those over the age of 50. Remember, there's no magic cure, but these steps can help reduce symptoms and shorten recovery time. And also remember, the same public health strategies that worked before still work now. That includes choosing outdoor over indoor activities, improving ventilation, open the windows, use the fans, use air filters to clean the air, wash your hands often, avoid close contact when possible, wear a mask in public spaces, and stay home if you're sick. You know, every layer of prevention helps slow the spread. And slowing the spread means we help protect our most vulnerable neighborhoods, our neighbors. Let's take care of each other and remember, the best COVID infection is the one you never have. That's my message today. Take care. Be well.